this year, parents heard about the Baby Box Initiative, which came to Cooper. Dr. McCans, who's a pediatric emergency medicine physician at Children's Regional Hospital here at Cooper, told us a bit more about sudden infant death syndrome, or SIDS, and it's SIDS Awareness Month this month. So, Dr. McCans, can you explain more about what SIDS is and what parents should know?
SIDS is the sudden death of an infant that after a autopsy, a scene investigation, and a review of medical records remains unexplained. But when we talk about SIDS, what we really need to also talk about is SUID, or the sudden unexpected infant death, which comprises SIDS as well as unknown causes, which really means that one part of the investigation after the death is missing, and so we can't make a determination, and unsafe sleep-related deaths, which can include suffocation, strangulation. Suffocation can include accidental overlying, and we know that those deaths are preventable through use of a safe sleep environment.
So when you talk about a safe sleep environment, what are some things that parents should do or should avoid when putting their baby to sleep?
So a safe sleep environment is an environment in which the infant is on their own sleep surface. They're not sharing a bed or a couch with another person. It's a bare environment. There are no bumpers, no pillows, no blankets, no soft animals. There is just a firm mattress, a well-fitted crib sheet, and the baby. And the baby is not kept warm with a blanket. They are kept warm with something like a halo sack or a warm sleeper. Babies need to be put to sleep every time on their back. About 25 years ago, the American Academy of Pediatrics introduced the Back to Sleep program, and that drastically reduced the number of SIDS cases we saw here in the United States. So it's important that babies be put to sleep on their back each and every time.
When we talk about a baby, how old is that? Like until what age?
Until 1 year of age, although the majority of SIDS cases and SUIDS cases occur prior to 6 months of age. But the risk is not really eliminated until after the baby's a year of age. And rarely with unsafe sleep circumstances, we have seen children who died even older than 1 year old from another person being in the sleep environment with the child and rolling over on top of them and resulting in suffocation.
So if parents want to learn more about avoiding these potentially dangerous sleep situations, are there resources out there? Is there more education that they can get out there?
There are resources. New Jersey is very fortunate. We have the New Jersey SIDS Center, and they have a lot of information, but you can also sign up for the Baby Box University, and if you have a very young infant or you're expecting a baby, you can get your free box, and that involves education regarding prevention of SUIDs. There is the CDC's website has a lot of information available. Department of Children and Family have pamphlets available. There's really a lot of resources out there to learn what is safe sleep. But something I didn't mention, but also important to help prevent SIDS, are different factors that we as caretakers choose. So the avoidance of tobacco in the home, that is a significant risk factor for SIDS to happen. Breastfeeding your baby until at least 6 months reduces the risk of SIDS. I'm trying to think, there's a couple other things. Avoiding substance use while caretaking, that is also something that can reduce these risks. So there are lots of things that we as caretakers can do to reduce the risk of children, infants dying from SIDS or SUID. We can't eliminate it in total. SIDS, for the cases that are defined as SIDS, we don't know exactly why those babies die. We know things that we can do to decrease the risk. That doesn't mean that you can't do everything right and a baby will still die for SIDS, because we don't fully understand what SIDS is. So it's important to understand that we want the risk to be as low as possible so that as few children as possible die.
Well, thank you so much for taking the time to explain some of these points to us. We're going to include more information about SIDS, about the resources that Dr. McCans mentioned on our blog. So if you have the opportunity, go to blogs.cooperhealth.org and visit Inside Cooper for more information. Thank you so much. I really appreciate your time.
Thank you.